Hi, I'm David Duga. I'm a student physical therapist assistant, and today we're going to show you how to do some transfers. We have Miss Monroe with us. She has a posterior lateral approach total hip replacement, and this is all on her right leg. And so we're going to have her situated in a way to where the wheelchair is on her left side. So every movement is going to be going towards her left to get into the wheelchair. First thing you're going to want to do is assess your environment, make sure it's ready for a transfer to take place. So we're going to look at the wheelchair right now, and these foot plates are going to be in the way of the transfer. So we're going to go ahead and take these off. Next up, we're going to make sure that the wheels are locked in place, which they are, and we want the wheelchair to be close enough to the edge of the bed so that she can make this easy transfer and not fall in between. Make sure that the caster wheels are facing forward. The one closest to the bed may be turned slightly if it's going to get into the way of the transfer. And for her, we're going to want to put some pillows on top of the seat, so that way she maintains that 60 degrees or less of flexion at the hip. Other precautions will be a deduction past the midline and internal rotation of the hip. So the next thing we're going to do is make sure that all the lines are in their proper places. We don't want anyone tripping over it or them becoming other hazards. So we're going to assess. You can even ask your patient what lines that they have, if they're coherent. But just make a full assessment, and I noticed that she has a dorsal in the hand IV. We just want to make sure that that line is not going to be stuck by anything else. And I also see she has a catheter. So we're going to find her catheter bag, make sure it always stays below her hip line. And we are going to attach this catheter bag under the X frame under the wheelchair. The next thing we're going to do to make sure we're doing this as safely as possible is to put a gait belt around Miss Monroe. So you can ask the patient to go ahead and get up on her elbows to give you some space to go ahead and put that gait belt around her. So Miss Monroe, if you don't mind getting up on your elbows for me, if you can do that. Turn this down a little bit. You feeling all right today? Good, good, good. We're going to get you moving a little bit today. That's all right. Not too tight? So the next part in the transfer is we're actually going to get ready to physically move the patient. First thing we're going to have to do is pull back the sheet. So you want to ask your patient, make sure she's fine with that to maintain her modesty. So is that all right with you if we move back the sheets for any person? Okay. And you want to make sure you know she's clothed and whatnot. Also, you want to make sure she has some non-slip shoes if that's available. It'll be really good for transferring, especially when we get to the standing part of the transfer. Okay, now just reassess your lines, your IV line, your catheter line. Make sure that they're out of the way, they're not going to stick on anything. And next thing we're going to do is get the patient to sitting. So next we're going to get a pillow and put it in between her legs to make sure that her right leg doesn't abduct as part of her hip precautions. And then this patient is weight bearing as tolerated, so she will be able to help you out some. All right, so the next thing we're going to want to do is to scoot towards the edge before we go into sitting, and to do that, if your patient can, we're going to have her on her elbows, and if she can bridge and then move her hips to the side, and this will put her right hip in an abduction, which is fine for her posterior lateral approach. All right, so if you can, I'm going to have you pick up your hips, Ms. Monroe, off of the bed, and then shift your hips towards me. Perfect, perfect. And your legs follow. Once more. Right there, perfect. The next step of this transfer is we're going to be holding the patient's legs, and we'll be guiding them towards the wheelchair and have them shift their upper body and pelvis towards the other side of the bed, so that we end up being perpendicular to the bed. Make sure that you're not pulling her legs, pulling her into abduction. You're just guiding her as she moves across. So Miss Monroe, if you can, we're gonna have you shift over towards so that your body goes out like this. Is that all right?
Yes.
I'll help you out. Perfect. All right, right there. And we want to make sure that she maintains a pelvic position under 60 degrees. Next, we're going to have her shift forward to you. So if you can on your arms, just push forward towards her. And you just want to make sure you always have her gait belt. Okay. All right, so the next part of this transfer is again reassessing your arms, making sure that they're not going to be obstructed by anything. Then after that, make sure that you're going to have both feet on the inside and outside of her left foot before you go and guide her through this transfer. She is weight bearing as tolerated, so she can fully weight bear on her left hip as long as she allows it. So the next part we're going to have is I'm going to have her stand up, but she's going to be on her elbows. I'm going to grab her gait belt, and then to get her to standing, I'm not going to just pull her up from this position. I'll be shifting my weight backwards, which will cause her to pull forward. We'll get to a standing position, and we'll pivot, and I'll ask her to reach with her left arm down to this left hand, this hand guard right here. And after we do that pivot, it'll be the same maneuver to slowly let her down as shifting my weight forward slowly as she goes down. All right, are you ready?
Yes.
Go ahead and shift up on your elbow. I'll get you up. All right, 3, 2, 1. Up. Turn. Grab that. Slowly do that down. Now to transfer Miss Monroe back onto the bed, because of her hip precautions, we still want to lead with that good leg. So we've turned her chair around as if she's coming back from rehab or wherever. And now we're going to basically be doing the same thing as we did earlier, but in the opposite direction. So before we begin the transfer, as always, we're going to want to make sure that the lines are not going to be in the way, because she'll be standing and pivoting, and the line is going into her left arm. Going to go ahead and push the IV pull back, and the line will droop this way. We'll make sure it's not going to catch anything as she does the transfer. And we're going to ask her to scoot forward a little bit, but it's going to be a little different than most wheelchair patients scooting forward, because she can't have that 90 degrees of flexion. So we're going to ask her to maintain that under 60 degrees posture, and to slowly scoot herself forward by weight shifting from one hip to the other. So if you can go ahead and scoot a little forward, just to the edge. Perfect. And then the next part is just to lock her feet and her knee in place like we did when we transferred her to the wheelchair, and we'll do that to get back into sitting. But we always just need to be cautious and make sure that that 60 degrees is not broken as you get to sitting. All right, Miss Monroe, you ready?
Mm-hmm.
Okay, go ahead and you can push off with the wheelchair to help me out. Ready? Now lean back. Perfect. All right, now that we got Miss Monroe sitting in the bed, we're gonna want to move the catheter from under the wheelchair to the side of her bed so that it doesn't get stretched as we go to sit, get her all the way laying down. And also, because she's going to need to swing this leg around, we're going to back up the wheelchair as well. Now always be watching your IV line as well. Make sure it's out of the way. And now what we're going to do is have your patient, Miss Monroe, she's going to use her arms and elbows and bridging and try to crawl back as you're holding on to her legs, and then she'll swing forward as you're guiding her with her legs. So if you can, Miss Monroe, just scoot backwards as much as you can. Thank you, right there, that's perfect. And go ahead and swing towards your pillow. Perfect, perfect. So the very last part is to put the room back together how it was when you found it, to make sure Miss Monroe is as comfortable as possible. So the first thing we're going to do is bring that wheelchair back around over here for her next transfer. Make sure to lock it up. Make sure the caster wheels are forward. And because she did have the foot plates on there earlier, even though we didn't need to use them, we're gonna put it back how we found it. So we'll go ahead and put these right back on. Next, we need to remove that gate belt from Miss Monroe. And we'll also pull her sheets back up and just get her all comfortable and ready for the rest of the day. Find any remote if she's watching TV to hand to her and just ask her, Miss Monroe, are you comfortable?
Sure.
Great, great.